have everyone's attention? Thank you. I'm going to start out by taking the roll call. This is for our members of the committee. We'll start over here on the side, my right-hand side.
Sorry. Ray Joyce, 13.
Not a member.
Not a member.
I'm not a member.
Not a member.
Not a member.
Not a member.
Okay, over here. The members are on this side.
And they're all on that side. I'm not a member.
You're an ex officio.
Do the members have a
Whatever.
quorum?
Not official.
Paul Bergdorf, 21 Latham Loudonville in the village of Colony.
Mark Grimm, 29, Gilderley.
Lynn Lakakis, 8, City of Albany.
Okay, Mayo, 20, Latham, and all of Albany County.
Bill Buddy, 12.
Okay, I want to Bellingham 3rd Legislative District. I would also like to take attendance of the members that are here and representing other districts, starting with Mrs. McKnight.
Thank you. Lucille McKnight, First Legislative District, Second Ward.
Vicky Plotsky, 38th District.
Matthew Peter, 5th Legislative District.
That's right.
Merton Simpson, 2nd Legislative District.
Sam Fine, 6th District. Dennis Feeney, 28th District.
Thank you very much. So we're going to get started. Mr. Secor from the Veterans Bureau. And those of you that have the budget book, please, you can turn the page. Start on page 202. The actual budget is on 204. Good evening.
Good evening.
We'll let you begin.
For our budget, there is really just about $6,000 increase from last year, and it's all, the majority of that is 2% increase in salary and slight increases in a couple of our programs, that's all.
Mr. Secor, could you just spend like a minute or two on telling us what the Veterans Bureau does?
Sure. Our department, we service the almost 19,000 veterans within Albany County. We help them with finding the benefits and resources that they require. It could be anything from filing claims to needing a ramp built for their house or things like that.
Are there any questions from the members?
Madam Chair?
Mr. Green?
Thank you. Yeah, it's really a great clearinghouse for veterans. I was just talking to one at the doors the other day, and I said, be mindful that whatever service you need, you can be helpful.
Absolutely.
How are you guys advertise your services to groups so people know to call you in case they need stuff? Because I think that's important.
We are embedded with a lot of the veteran organizations within the county. There's approximately 57 within the county. So we've established a presence with all these organizations who push it out to their members. And of course, there's a lot of veterans who aren't members of these organizations, but they're friends of people who are in these organizations. So that's kind of the main way that we push out our information. But we also do outreach and as far as like events, ceremonies, and things like that. And right now, I think we are up to about 121 events that we have done this year.
Any other questions? If not, thank you, Mr. Secor. All right, we're going to move to social services. Good evening.
What page?
Page 190. Starts on 189.
189.
Department of Social Services.
Close. Around.
All right, good evening. Good evening, how are you? Not too bad, how are you? Pretty good. All right, would you like to start?
Okay. Good evening, Chairwoman, and all members of the committee and other legislators here. I'm Michelle McClave, Commissioner at Albany County Department of Social Services. I have Joe Viscuso, our Director of Accounts, with us. And I have my deputy commissioners and our policy analyst to answer any questions that you may have on the budget, which basically totals $135,530,000 some total, with 66,905 of that going towards the mandated payment that the county must make for the Medicaid program, and $68,625,000 for all other staffing and mandated programs that the department is required to provide. So we are here to answer any questions you may have on the proposed budget and the submittal that we gave to the committee.
I'm not on the committee.
Okay, questions from the committee? Yeah, Ms. McKnight?
Thank you. Good evening, Commissioner. Commissioner, we hear it so often in the minority community, I'm a member of the majority minority community, is what percentage of all those millions of dollars are spent for programming in the majority minority? There are so low income and much needed services for the sick and disabled youth and adults there. Could you give me a hint, or would you have to put that together for us?
I would definitely have to put that together. Our services are for the entire county.
That's correct.
The population centers, of course, utilize our services at a higher degree.
Good. Well, what I'm really thinking about is the coming of the Raise the Age program, which is developing, and it's going along pretty good. And what kind of impact do you think that'll have on our existence program for thinking about the kids who are coming in with mental health and Medicaid problems or some kind of health issues from the Youth Detention Center out in Colony?
I might let our
Gail,
DCYF
I'll save that. Want me to save that question for Gail? I'll get you, Gail.
Oh, yeah.
I'll get that for Gail.
She has an expertise in that.
You're not on the spot yet.
Okay, all right. I'll let somebody else bother you.
I'll start with a question here. I see on page 195, there's a spike in your overtime, okay? So, can you explain the fluctuation in the spike in overtime like the one in 2018?
Well, our 2018, yeah, we spent 16,000. We're asking for 19.5, just a little bit, a small percentage additional, just in case. What?
Thank you.
That's what we're trying to do.
Oh, okay, sure. We expect to get close to that this year, as far as I know, because at this time of year, we often are behind, and we do some catch-up for our programs, and there's a real need for that at this time of year, so I'm not sure where we're at.
Yeah, through September, we've only actually spent $6,500, but we do have those overtime projects that are taking place this month and anticipated to take place next month as well. So I think we probably will come close to the $19,000 that we appropriated, but we're not there yet.
Okay. Mr. Peter?
Thank you, and thank you, Commissioner. Question, when with your emergency team and, preventing evictions and reinstating utilities, when do you get to the process of preventing the evictions? And there, I swear there's a budget question in here, so just stay with me on this one.
Well, by state law, for us to pay for someone's rent, they must have the eviction in hand. So they have to have far along in the process.
So my question on this, and this is obviously going to go towards state law and potentially something that might go towards saving the county money, and that's why I just want to sort of talk this through. If there was a way you could sort of do it on the way to eviction process, before they were court-handed, before they had to go to court, before the landlord had to do it, before there had to be a process where they're so far along the process, same with utilities. If there was a preventative measure that you could do, would that save you money in process, and therefore the county money in process? And I understand that's state law, but I'm trying to get a holistic
If the law was different.
If the law was different, do you think that would not only help landlords and probably those seeking being evicted, but would that help the county?
It would help the individuals coming to us for assistance. It absolutely would. Keeping them in their home is a much better option than making them homeless. And homeless services cost a lot more than keeping somebody in their own home.
Okay.
So that's anecdotal. And certainly if we can get them when they're starting to get behind on their rent, as opposed to months and months of non-payment. It could be less per person that we might end up paying.
Okay, thank you.
Okay, let's stay on the homelessness. Overall, what do you see as the trend in the size of the homeless population, the number sheltered, and also the number of street homeless?
I can get you some of those figures. The trend is a little bit disturbing in that in other areas of our services, some of them are going down, but our homeless numbers continue to stay where they have been, and in some areas they're increasing a little bit. So some of our women, we're seeing a little bit more women, which is different. So it's hard to tell what's going to happen this winter, but that's where we've been in the last year or so.
Mr. Bergdorf?
You said in some of your services you're seeing declining populations, or you're seeing some down trends. Which of those would they be?
Well, it's the family assistance, TANF program. That's the primary one.
And what do you attribute that to?
A better economy, potentially?
I mean, more people working?
Yep. Not coming to us for assistance. Yeah.
And how significant has that been?
Not major significance. I think we gave
I mean, was it an uptrend before and it's a slightly downtrend now?
In our trend chart here you have from June of 18 to August of 19, you can see our family assistance. Actually, in August, it looks like it went up a little bit. In September now, it's a little bit down. So it goes up and down, really. But you can see the trend here.
Yeah.
Thank you. I have another question. Can you please explain the domestic violence shelter appropriation shifts?
Right. The DV shelter appropriation shift.
Yeah.
I'm gonna let Joe handle it.
Sure, as best I can.
What page are we on?
Where's that?
Explanation.
In the explanation.
Oh,
Equals in the explanation that was provided. And that would be,
Well, safety
Sure,
net
sure.
and,
Safety net family assistance.
which is application timeliness snapshot. Everybody have it?
Yeah.
Okay, please, shoot.
So he can snap us.
Yes. This side.
oh, okay, good. You got one?
Okay, so the programs that are affected by this change are the Family Assistance Program and the Safety Net Program. Around $500,000 of appropriation in each of those programs have moved to the Purchase of Services appropriation code. And that's driven by a change in the way that the state is having us pay our shelters, our domestic violence shelters. Previously, we were able to pay them within the system where the person in the shelter was identified and they could be linked to a particular type of case, either safety net or family assistance, and those costs would hit those programs. Now, the rule is that they cannot be identified, and we are getting bills from the shelters without these individuals identified, so we can't put them to a certain program, so they're going to be paid out of purchase of services.
Now, I have another question. There's a long list of positions receiving pay increases of over 2%. And so I don't want to make any assumptions as to what that, so can you please explain briefly as to what those increases look like?
Yes, on the document that we responded with, in the comment sections, you'll see specifically what drives those increases. They are usually a change in the step for that position. These are union positions, and on top of a 2% increase, if a person who has been in the line for, say, 3 years, 1 year, goes to the fourth year step, there's an additional increase besides the 2%, or if they've gone from the fifth year step to the 10th year step, because there's no 6, 7, 8, or 9, that's a big increase. So these are all step increases for the most part, from one lower step to a higher step, either because an individual has moved in their employment to those steps, or a person has changed, maybe they left that position, and a person with a higher number of years of services has filled that position, so at a higher step. And that's what drives those costs.
And all of these increases are union contractual increases.
Leo?
I see, it looks just at a quick glance, about 50 job vacancies. Are there any you think could be coming back in a short period of time, back to us to fill any of them?
We're actually working really hard to get a lot of them filled, and since we submitted this, more offers have been made on these positions, so it's the civil service process sometimes takes a long time. We have to pay out vacation potentially for a position, and that we have to delay filling it. So there's many reasons why we have a lot of, and if we promote someone, so it's a constant trying to backfill all of our vacancies. But we're working really hard we're really concentrating on getting a lot of these filled as soon as possible.
Thank you.
Ms. McMahon?
Yeah, a few years ago, we started this program in conjunction with SUNY to do like a equity training for train-the-trainers, more superior staff would train the lower level ones, trying to get identification of their right titles so we could adjust the pays and make everybody kind of the same. How is that coming, or is it still in effect, or is they still working that program? It's called the equity program that went through social services?
That's occurring out of HR and the
Okay.
county exec's office.
Oh, it's not coming out of social services though anymore?
No, that's a county-wide program.
Okay, all right. But it's not affected by social services?
We had Bridges Out of Poverty training, for
Yeah.
instance, last year that came out of that program. So there's some trainings we're getting as a result of that.
Now, with the 50 positions that's listed that could be considered for placements, are any of the people who are in lower level positions, under these positions, being offered some of these so they can move up in their salaries?
Right, we
Are you
really
working on
want,
that?
we encourage promotion from within, of course. We want to retain people that we've already spent a lot of time training. But you have to be reachable on the civil service lists, of course. So we, try to get through the lists as quickly as we can.
So all these 50 positions, you have to take a civil service test?
Yes.
Most of them?
I'm
Oh,
pretty
boy.
sure, I don't know if every
Everyone
one
is.
of those is civil service. There might be a couple that, the majority are civil service, yes.
Okay, all right. Well, thank you.
I may not have had
They're all
any.
civil service.
They're all civil
They're all
service.
civil service, okay.
Madam Chairman, thank you. Just a quick question on page 196. This might be going back to the increased payments for people in the shelters. At the bottom of the page, A 60, 70 service recipients, it's going up to 3 million from 2 million. Is that a result of the issue with the shelters?
It is. It's the 500,000 from safety net and the 500,000 from family assistance moving to purchase of services, which is where those DV shelters are going to be paid from now.
Okay, thank you.
Ms. McQuaid? Yes. Now, do you see any new unfunded mandates that might affect the budget, from the state or the federal government?
Well, the domestic violence, the reimbursement for domestic violence shelter is a big one for us. It's a huge shift that just started occurring in April of this year. A law was passed and it was implemented in April. So we're not even sure exactly how much it's going to hit us. We haven't even processed very many of those bills yet. That's a big one. And then the other one I mentioned was the CFCO program, which is part of the New York State Department of Health instituted a new initiative for people for care at home. So it's expanding home care services to require us to contract with providers to do equipment modifications, vehicle modifications, home modifications to accommodate people who have disabilities so they can stay in their homes. And we are required to do all of that work without any additional resources.
Are there any other questions from members?
I think I'm satisfied.
Thanks, Madam Chairman. It looks like 50% of your hearings are no-shows, so I'm sure that's quite an expense,
Wow.
labor
Yep.
and effort.
Yep, it's a lot of staff time and work to prepare for each individual hearing, so that's why we've instituted we're trying to institute a new process where we try to contact the client prior to that fair hearing to talk them through their case and try to get them to see either that we were correct or if we were incorrect, to make that correction before the fair hearing so that we don't have to go into the fair hearing. Sometimes, we can't get in touch with the client, or they choose not to withdraw the fair hearing even though we've had a conversation with them, and we still must prepare every one of those and show up if the client doesn't show. So,
What is the outcome if the client doesn't show? Oh, I'm sorry.
No, I just, because people, we're being taped, I want people to know who's speaking or asking.
Excuse me, if a client doesn't show for a hearing, is there a disposition or?
The client can call a fair hearing again if they so choose. If they still feel like that they couldn't make it to the fair hearing and they still have a case, they can recall a fair hearing, or the judge can make a decision based on the materials they have.
Mr. Joyce?
Yeah, just to follow up to Mr. Peter's comment, is there a line in here where I can find the expenses related to the rent and the utilities?
The EAA, Emergency Assistance, I think, might be what you're talking about.
I'm sure it's in here, I just can't locate it.
Page 198, Emergency Assistance, Emergency Aid to Adults.
Is that 03642?
Adults. That can't be it.
6142.
Oh, 60, okay.
Right. Then 03642, you're correct.
That's the second number.
Which number?
Both numbers together.
Oh, that's mine.
Emergency aid for adults. That can't be it.
Thank you. I guess just
Well, also, just to clarify, that's only for one population.
Yeah.
If you're eligible for safety net or TANF, it'll be paid under those programs then. So there's 3 ways to pay it.
only because it's near and dear to my heart, electric and gas, looks like you had quite a rate increase from 18 to 2019, almost 3 times in electric and gas. Mr. Bullock's gonna have you put solar panels on your roof.
Here's gas and oil. 2018 extended.
They're looking at the expenses.
Yeah.
Oh, I'm sorry, I missed it too.
You guys didn't take any more square footage on or anything, did you?
Electric, over here.
Where are we, what page?
195.
195.
We go to 195.
Yeah.
195.
Mr. Joyce, can we get you a breakdown of what it is for the current year?
Sure.
Just to make sure we're on trend here.
Thanks, Sean.
If you have any other questions.
Thank
Mr. Pine?
Thank you, Madam Chair. So you mentioned there was a rise in homelessness, and I'm wondering a couple things. One, where is is there a line item in the budget for the homeless shelter payments?
Yes.
'Cause I was looking for that.
They come out of, they could come out of safety net or TANF if you're eligible
Okay.
for those programs. And then would some of them come out of? Yes,
Contract, homeless is strong.
right, which is safety net or TANF.
Contract.
So they come, okay, one of those?
Yep, they're
And then-
embedded in those lines as well.
And then, are you doing anything to address the rise in homelessness? Is there more that we can do to get people into permanent housing rather than being in shelters, for example?
Sure, it's true.
We hope that but our primary goal is to get those sheltered that come to us in need. We have our contracted shelters doing the work of placing people and finding housing for folks. And working with them, they develop a plan for each individual to develop a permanency plan for obtaining housing for them. So, and we pay the eviction, eviction prevention is the way to keep people in. But, there's many reasons why people become homeless.
Yeah. Do we know what the reasons are, or have a breakdown? Is there any way to survey people to find out exactly what the main causes are of homelessness?
I'm sure there are organizations that have studied that, and CARES comes to mind. They're the homeless expert. They've done a lot of research on this. Primarily, it would be low income or no income, or ability to pay your rent. Some emergency occurs. You have behavioral problems, mental health problems, substance abuse problems. You have code violations in your house. You have a fire. There's many, many reasons why people come to us for who are homeless.
Yeah. Okay, thank you.
Thank you. So if there are no other, any questions, we'll just want to say thank you, and we'll move on to the next one.
Great, thank you.
Good.
The next committee is health committees, page 199. Would you like to make a presentation?
Yes, we're very happy to be here tonight. 2019 was a good year for the health department. We received National Public Health Accreditation, and I think we've put a pretty good budget together. We haven't got any significant changes this year other than the request that we've made related to the new lead mandate that's been passed by the New York State Department of Health, and I'm happy to answer any questions.
Any questions from the committee? All right, I'll start by asking a question. On page 2 of the, in her responses, all right, I'll stop at this, lead control mandates. All right, we received a 36% offset of the $406,000 in salaries. Is this going to be ongoing, or is this just a one-time benefit that we're going to receive from the state?
The 36% state aid is ongoing.
It is ongoing?
Yes, it's ongoing, related to core public health activities.
All right, can you also discuss the additional positions related to lead poisoning prevention program?
Yes, I certainly can. So this year, the governor mandated a lowering of actionable lead level from 15 micrograms per deciliter, which is a blood lead level. All children of the age of 1 and 2 are mandated to have blood levels. And we know that in older housing stock, there is a higher risk of children being contaminated with lead. So they have lowered the actionable level from 15 to 5. We have a lot of data from the state, and we were able to look at those numbers in terms of what it would mean for our workforce to be able to enforce this legislation. And it looks like we will be doing 10 times the amount of home visits that we were doing last year. We put together a very neat and good perspectives on what it would cost us. And this is what these positions are coming from. I will say that NICEHO, the New York State Association of County Health Officials, and the counties are reaching back to the state to address concerns that we have, that the state has not provided funding for this. And the model that we use to determine the need that we would have for additional staff has been now adopted at the state level for other counties to go forward and ask for funding.
Mr. Simpson?
Yeah, I'm going to a conference at the end of this month in Newark, New Jersey, and they've discovered that there's a serious problem with lead in their pipes. And I have to imagine that it's in balance of New Jersey as well as New York, since the pipes are the same vintage. Do we know of any problems closer to the inner city in Albany where we have identified problems with lead in the pipes?
Now, when you talk about pipes, are you
Water,
specifically
water,
talking about
water.
pipes? We do not. We have, there's a mandate to do lead testing of water in schools that is being rolled out, and we have a program that tests, it's a voluntary program where people can have their water tested, and we have not identified a significant concern. The vast majority of lead poisoned children that we see, and I'm talking on the order of 99+%, are children that have consumed lead chips from
Right,
paints around,
right. That old
around their
problem.
house.
Okay, thank you.
Mr. Bergdorf.
Doctor, you're talking about the lead program.
Yes.
And I'm just reading through, other dwellings where children with elevated lead level above 5 something per deciliter currently reside or visit. How do you know who those children are?
So there's two different ways that we find out. We find out from pediatricians, so all of those lead levels that are done at the pediatric office come back to us. And when we get those levels, we go out and we look at the homes based on the actionable lead level. So we find out, we get that direct report from the state, every child that has a lead level above 5. So we will get those reports directly to us. We also have a second grant that can go out proactively, so if landlords are looking to rent something and they want to have somebody look at the home to see if it's risky, we can have people go out and look at the home under a different grant that we have. And sometimes in those situations, we'll find areas that are at risk where children may be in the home that haven't been tested, and we refer those children to testing.
Thank you.
On page 129, it says, are you eliminating the item A 4010-12-600? And it's the senior public health planner position. There's no salary for 2020.
Yes, that was eliminated actually in the 2018 budget. We did a RLA mid-year, and we converted that position into the Director of Emergency Management.
Okay, thank you. On page 1 of the responses that you made to us, there seems to be a significant number of vacancies compared to the size of the agency. Can you tell us why that is, and what do you see as a time frame for, filling them?
Yeah, so, in terms of why we have vacancies, I would say that there are primarily a couple of reasons. The first and most important reason is that we are co-located with the State Department of Health, and their salaries are much more competitive than ours. And when I say much more competitive, it is in a small margin. People can go and where they may be paid $50,000, they would go and be paid $100,000 there. So it's a very difficult gap for us to consider filling. We have a population that's nearing retirement in the health department, and often we will find people that are close to retirement will go work to the state, even though they've been with us for years and years, because they can use their last years of service at a higher level. And then we have, younger people that come to us and use the health department as a stepping stone to go work at the State Department of Health. So I think that's the primary reason that we do have the vacancies that we have. We are looking to fill all these vacancies and reviewing resumes currently, so I'm hopeful that we'll be able to fill them very quickly.
Are there any questions from the members?
On the page 1 in our response,
McKnight.
thank you. Doctor, I see that there's 9 positions for your reviewing resumes. Is this also taking into account the affirmative action plan that we put in place?
Absolutely.
And you report back when you
Yes.
get people who might be suitable to fit in that criteria with the
Yes.
protected class? You are?
Yes.
Okay, then, good, thank you.
Thank you, Ms. McKnight.
Yes.
Are there any other questions from the members? If not, thank you and good night.
Thank you.
Climate change.
What's the organization?
It's a global consortium called Humanities Action Lab. 79 Sheridan Avenue is being showcased globally as an environmental justice community, so it helped us a lot with dealing with the governor. It's really a big thing. It's very exciting. It's at Rutgers University in Newark. But they have built, Coriel.
Good evening, John.
I don't think so.
Can we come to order? Would you like to give us a presentation tonight, please?
Thank you, Madam Chair. Good evening. I would like to say that I'm joined by my Deputy Director, Susan Daly, and my Associate Director, Kelly Roberts, who have promised to assist me in answering your questions. You have before you a proposed budget that I think reflects the enormity of the work that the Department of Mental Health is doing in our community. We have managed to keep costs fairly stable. We're running a more efficient operation, and we've increased our revenues. And, we're pleased with where we are. I will just say that, and you've heard me say this before, our business is brisk, and that unfortunately is not a good thing.
No.
But I'm here to answer any questions that you or the committee may have.
I have my annual question that I always ask you. Yes, I'm not on the committee. He's first.
Dr. Giordano, thank you for being here, and I also want to thank you for participating in LEAD with the City of Albany, as well as coming into my district to talk about many of the concerns we have with the, with the homeless population, with the mentally ill population, as well as the addicted population. I noticed in your response that your mobile crisis team nearly doubled its contacts between 18 and 19. Yet your budget remains relatively flat. What I'm asking is, are you asking, do you have enough resources to continue this, given the enormity of the opioid crisis and the mental health crisis, and how vital those contacts are to prevent negative outcomes with first responders and law enforcement? Do you have the resources you need?
Well, there's a lot packed into that. Let me try first to acknowledge the fact that you are correct that our mobile crisis team has almost doubled, if not more than doubled, their contacts in the community. That's largely because in the last year or two, we were benefited from a relationship with Albany Medical Center and in the DISPA project. They allowed us to move from a 2-shift model to a 24/7 model, which we did many years ago. And that allowed us to bring on resources to manage that extra shift. And that extra shift, even though we only increased it by a third, we almost doubled the amount of contacts. So it speaks to, I think, the need and the hard work. Do I have what I need? I will just say this. This has come up every once in a while. And I usually say, if you gave me $1 million, I could spend it. But we do a really good job with what we have. And I think, the problems in this community reflect what you see across the state and the nation. It's a growing issue. I think that we are handling the needs in this community well. Yes, our productivity is up in all regards.
And to follow up on that, if I may, Madam Chair. It sort of goes on to where my district has issues, is what I would consider, where there's sort of like a blackout of services, right? It's after the standard 5 p.m. workday, and it's on the weekends, where some individuals have trouble getting prescribed prescriptions. So if they don't have their prescriptions, they get worse and worse, and then they act out on weekends and things like that. And they're in my neighborhood, they're in Merton's neighborhoods and things like that, because we're in between lots of areas of care. We're in between 3 hospitals, several addiction centers and things like that. So when people can't get the aid they need at a certain point, they end up, having really bad episodes and other things within our communities. So my question sort of goes back to this: with additional resources or with additional programming or even law changes or things like that, could you cut down in when there's those services that are needed on those weekends or at night, or or do you need to partner with the law enforcement so that there's a mental health professional that are meeting first response with individuals who might be having a mental health crisis?
There's a lot packed into that as well.
I don't ask easy questions normally, so this is good.
Yeah, so, in my position, it's a blessing and a curse. I'm very proud of the work we do, but I hear all of the bad occurrences and outcomes. I hear about many, if not all of those situations because they get jammed up at the crisis unit, or the police call me at 2 in the morning because they don't know what to do with someone. We're working, all I can say is, I acknowledge your observations. I think those kind of problems in the system are decreasing. We're working very, very hard with law enforcement. We've just trained another class in our crisis intervention training. We're almost at 300 law enforcement officers throughout the system. And our providers work very hard to not let patients get to the weekend without their meds being refilled. That's almost an easy one. I mean, unless folks are new to the system. There's a lot of challenges here because the psychiatric system in the state's shrinking. The court system seems to think the mental health system is the answer to all their problems. They discharge people to us. They're sicker. They're more violent. So that your observation is correct, but I can only say that we're swimming as hard as we can to address those issues, and we have partnerships throughout the community with the hospitals, with law enforcement, with our other providers to cover those gaps. So
My only response to that would say that if it means that you don't remain flat, but you have to go up 0.5% or something like that, and it can further cover that, because I think your department's doing a fantastic job. But this is a crisis, and staying flat is not necessarily the biggest thing we have to say with that if there's still a need. That's all. And
No, I appreciate that. I hear what you're saying.
Thank you. Ms. McKnight, I didn't forget you.
Well, thank you. Now, in my neighborhood, I've had some big murders and shootings.
I'm sorry?
Murders and
Yes.
shootings from kids who are maybe 16 to 26 or whatever. Do you address this audience of children and youth and young adults?
Well, for the second time in the evening, I'm going to defer.
All my questions get deferred. Did I cut the numbers off to her?
That's a beat.
Because I thought I heard above 18.
I did say 16 to 26. Absolutely part between 18 and 26.
We share the burden.
You do share the burden.
And I think,
Okay.
with any luck, most of the youngsters in the community are going to become adults at some point, and if they weren't in our system to begin with, they will end there, or they'll end up in our system. A lot of the work that DCYF does mitigates a lot of those problems, so we don't have to deal with that. But we talk all the time about the kids and the young adults who are susceptible to all of the challenges in a community, as well as being at an age where first episode mental illness might strike and complicate things. So are we addressing it? Yes. Can we do more? I mean, we try to do more every day, so we're quite aware of what's going on. It's frightening.
Well, often they don't call it mental illness,
Oh,
and that's what makes it so hard to, to address.
Yeah.
They don't think that you're a little off or whatever you want to call them. But how do you get that attention, and how does it flow into you, into your desk, in your office? Through the police, through 175 Green Street, or through the emergency room, or what, and how?
Well, I will say yes to all of those things.
All
I mean,
three.
You're always welcome to come down and visit us. And you've
Oh, I
come
know.
before, but
I used to work there.
Sit with me for an afternoon. All of those people are
Come
calling
through there,
us
okay.
on a daily basis. And I will say that in the 9 years that I've been doing this particular role, we've developed some extraordinary community partnerships where we know who our partners are, we know how to reach them. If we can't do it, the county's in a position where we can't really say no, but sometimes we need help and we know who to ask it of. But I mean, your observations are correct as well. We're trying to address those problems as we can.
Thank you, Madam Chair.
Are there any responses?
Thank you, Madam Chair. Item 8 on page 2 of the handout.
Of the question or of our letter to you?
Of the letter to,
Yes, please.
it discusses the Access Hilltowns
Yes.
grant, and that it's funded through September 30th, 2019. So what's the prospect for that grant? And
Did we say that? Or is it funded through September 30th of 2020?
Here, 2020.
Right, it's not.
it's a typo.
Oh,
Excellent.
sorry.
Thank you.
I don't see where you see it as 2019.
The last line.
The last thing.
Oh, my goodness, no.
Okay.
We're just starting on that.
Great, thank you.
And we hope to be able to re-up that in
Yeah.
subsequent years.
Great, thank you very much.
That's a big typo.
Valuable program.
You're technically correct. That's typical.
What an eagle eye.
Doctor?
Yes, sir.
You were very helpful with trying to moderate a situation where a challenged patient walked out of CDPC and made his way to California. And I'm wondering if that experience has informed how you've dealt with that system and if any other similar episodes have occurred.
I remember that well, and I think of it often because I think it does give, it underscores a number of challenges. That was a young person who was of age to make decisions even though they were not the best decisions. And I think part of the challenge we often have is between families who might be acting in the best interest of an individual and an adult, may not always be a young adult, but an adult who's somewhat compromised in their decision-making, but it's a free country and they get on the plane. Yeah, it does inform what we do every day. I've not heard of any situation exactly like that.
Good.
But those kind of tensions between
Health and civil rights.
We can't force people to do what's good for themselves sometimes.
Sadly, yeah.
And sadly. And so we're always walking, it's a legal question and it's a
Civil rights, yeah.
civil rights issue. So yes, I remember that well and we're trying to be on guard for that.
Thank you.
Thank you. Are there any other questions from the members? Mr. Joyce?
Almost like.
Okay. If not, thank you. Thank you very much.
Thank you very much.
The moment we've all been waiting for.
Number 4.
The rock star is here.
Children, youth, and families. Moving right along, that's good.
Do you have our questions? Do you have our questions?
You got it?
Okay, yeah.
One page.
Yeah, all right, man.
Gotta stop throwing this thing at the wall.
Good evening, Ms.
Dropping English.
I know you've been anticipating sitting in that chair tonight.
Well, I'm like, okay, I can't have too many other people go before me because the list of questions is getting really long.
So, Ms. Gomez, this is from Children, Youth, and Family Services, and on page 84. And also,
Jumping around.
so let's get started. Would you like to start with a presentation?
Actually, I would. Good afternoon, good evening, everyone. So the Department for Children, Youth, and Families is an integrated department of child-serving agencies, including our Children's Services, Children's Mental Health Clinic, our Youth Bureau, as well as the Division for Special Needs. The goal of it is to be able to deliver seamless services to family and children across the child-serving divisions and agencies. That means that the majority of our services are actually mandated services, and that often comes with unfunded mandates. That being said, in 2019, our department has been able to manage costs in areas that have been historically challenging, such as foster care, preschool transportation, the Committee for Special Education costs, as well as our overtime. Through concerted efforts from our fiscal team, implementation of QA measures, we are going to continue to bring this oversight into our 2020 budget. As you look at our appropriations and local share, you will note that there has been a slight increase of $598,845 for our appropriations from 2019 to 2020, as well as a slight increase in our local costs of $745,879. Those costs are attributed to a decrease in our foster care block grant, which was not anticipated, as well as OCFS placements, and more imminent, the change with the PINS legislation, which takes effect as of January 1st of 2020, where there's no longer any reimbursement for PINS placements or detention. I am open to it. I can start by responding to some of the questions that have already been kicked to me.
I know I kicked a couple to you, so
Okay,
whichever
we'll
you,
start.
with the committee first.
On page 86, there's a raise the age contractual expense line, it's up $450,000. Okay, can you explain the general state of raise the age?
Sure.
And also looking, at, because of raise the age, there's another question in regards to the county cost $8 million regarding new PINS legislation. Okay? If you can please explain that.
Sure. So with the Raise the Age, as I'm sure the majority of folks are aware, it was implemented first in October 1st of 2018, where the 16-year-olds came into the juvenile justice system, and then most recently, as of October 1st, 2019, the 17-year-olds came in. With the implementation of Raise the Age, local districts had the ability to submit a Raise the Age plan to OCFS as well as DCJS in anticipation of what the increased costs would be with the incoming 16 and 17-year-olds into the system. So for the Department for Children, Youth, and Families, we looked at what we anticipated in terms of programs and services, because the idea of bringing the 16 and 17-year-olds is to be able to provide restorative services as opposed to what had been the prior route of going through the criminal justice system as adults. So those costs that you see are associated with programs and services that have been identified, such as the Juvenile Reporting Family Center, the Juvenile Accountability Board, as well as utilizing clinical services to be able to provide this to those youth and families who are now coming into the system through Raise the Age. On the PINS side, the PINS legislation does take effect as of January 1st, 2020. And with the PINS legislation, we will no longer receive reimbursement for any PINS detention placements or for any PINS detention or for any PINS placements. So that all becomes local share costs as of January 1st, 2020. For any youth that is currently in a PINS placement, it is not grandfathered in. So any of the 6 current youth that we have in placement as of January 1st, 2020, that is all local costs.
Okay, as far as the $8 million is concerned, in your explanation, there was something about $8 million and 8.
Could you tell me, are you referring to?
In your response, number 15, where you talk about the PINs, it says here, currently there are 8 Albany County PINs used in placement. And it gives a time in placement range from 1.5 years to less than 3 months. And then it also says here that as of 1/1/20, Albany County is potentially looking at $8 million in local costs related to PINS placements due to lack of reimbursement. I guess my question is, are those 8 youth in placement costing us $8 million?
Let me have everyone come down. That's a misprint there. That's a typo. It actually should be 300,000. My apologies on that. 300,000.
That's a big hit.
That was a misprint. My apologies. And so that's what's budgeted in 6110. My apologies.
Okay, we can cross that off right now. Before I go any further, if there's any questions, do I have any questions from the members? Yes, Mr. Grimm.
Thanks, Madam Chair. It looks like you're eliminating 3 positions and adding 3 other new positions. Do I have that right? From your handout sheet?
Oh, I've got to turn this thing off.
So yes, we are.
Number 4 is eliminating positions and salaries. That they come to, those 3 come to $177,000 according to my figuring. How much do the new positions cost, the 3 of those from item 2?
I don't have that in front of you. It is less than what the 3 eliminated positions are.
Okay, so your total employment is 24 this year and last year?
Would you like just a breakdown comparing the two, Mr. Grimm?
Yeah.
Okay, can we send that over to you, like, just?
But I basically, I just want to make sure I have this right, that you're asking for 24 in this budget, you had 24 last year. And the reason you're able to do that is you're eliminating 3 positions and adding 3 others?
Well, I need to check those
Yeah,
figures now.
so you have 24 and 40,
First down?
I'm looking at.
Page 85.
Thanks. Here's the next piece, and I'm looking at Big 87, 88, 89.
That's why you're down in position.
Total, what is that? There's 2 different ones? Yeah. There's more than, there's got to be more than 24.
Yes,
So-
6119
I don't know
is
what
the
this
rest of our
24 is.
staff.
Yeah.
We have staff in 3 different lines. We have it in, staffing are in 4059, 7310, and the majority are in 6119.
So what is the total staffing for both years then? Where is that in the budget?
Well, in 4059, it stays at 24. In 6119, it has gone from 179 to 178.
Okay.
And then there's 3 under both years for 7310.
All right, so there is no place where you list all the total employees, it's in 3 segments and you have to add them up? Okay.
That's due to the way that our department came to be with pieces of other departments.
Okay, well, that's why I'm asking. Okay, thanks.
Ms. Lakakis?
So in your narrative in number 13, you talk about one of 12 staff to salary, and then you further go on to talk about across the state, there's addressing other things like training and retention strategies, but if it doesn't seem to line up, if people are leaving truly because of salary, then how can we address this so that this doesn't, it happens across the whole workforce, and we hear it all the time, and I was just wondering if you had any ideas. It seems like you're taking steps to try to keep the people that you have, and it seems like that's a good thing to do, but at the same time, if they're leaving because of money, that's not going to change how well trained they are.
No, it's not, and I will tell you when you're talking about from the county to the state transition, there is a difference in salary and in terms of opportunity for the percentage of increase in salaries, and then also over the long haul, the opportunity for advancement. So when you look at our department, say if we're going to take the caseworker series, you can go from a caseworker to a senior caseworker to a supervisor B, supervisor A, director, and so on and so forth. As you go up the line, those opportunities for advancement are less because those positions are less. And so that is one of the challenges that we see. And then the other one is, yes, while we have tried to be proactive in terms of with negotiations with the union and so on and so forth, being able to increase the salaries, it does not keep pace when we start to look at comparatively what they can get when they go into the state, especially at similar entry-level positions.
Thank you.
Do I have any other members with questions? If not, I'll proceed on.
Oh, you go.
Okay, so there's a significant amount of money spent on overtime. And can you tell us what times typically work overtime? And with filling the vacancies, reduce, that.
So we have on-call, which is mandatory overtime. So during non-business hours, which are 4:30 p.m. to 8:30 a.m., we have to have a response if a report comes in from the State Central Registry. And we have a total of 50 slots that are dedicated just to that alone. And so that is definitely a significant part of our overtime, is because that is mandated. We have to have that provision. In addition, you brought up a very key point, is because with the vacancies that we have, there are less workers, but that does not necessarily mean that there are less reports coming in, so we still need to address that. So as you're seeing that, that difference in percentage in terms of the number of staff to take reports versus the number of reports are coming in and still needing to address that, then we're finding that there are more circumstances where there is a need for overtime, because again, we still need to respond to them, because these are matters of safety and risk, and being able to address those and respond to them as needed.
Can you explain the term 80 slots?
50, it was 50 slots.
Oh, 50, I'm sorry.
And so with our on-call, we have, there are 38 slots which are assigned to caseworkers, and 12 slots which are assigned to supervisors. And so between those hours, those non-business hours of 4:30 p.m. to 8:30 a.m., in order to be able to have someone respond to that, we have 2 caseworkers during the week that are assigned to cover those hours. On the weekend, because tends to be more reports that come in, we have 2 teams that are assigned. So on the weekend, from Friday 4:30 p.m. to Monday morning 8:30 a.m., we have a total of 4 caseworkers that are assigned, and there is a supervisor each night to be able to provide direction when and if a report comes in, and to provide guidance as to how to respond. And we can provide that if it would be helpful, the documentation of the breakdown.
Mr. Simpson?
Oh, yeah. A couple of things. A point of clarification for Ms. Lakakis, to just give you a sense of perspective. The old State Department of Social Services had 3,000 employees before Senator Bruno broke it up into temporary disability, children, families, and took the IT positions out. The county has approximately, give or take, around 3,000 employees. The City of Albany had a coordinator of housing, minority women business that paid $50,000. The qualifications for that position allow somebody at the state level to make $93,000. Those positions are in every state agency, and there's a really significant promotion ladder. So we're at a very, very significant deficit in terms of being able to hold on to qualified people. But Commissioner Groenewegen, you know that recently we had 2 meetings to deal with the issue of violence in the inner city. And, you've probably been hearing about the recent problems. I live at 295 Sheridan Avenue, which is like ground zero for a lot of the shootings. Over the weekend, we had a shooting Sunday morning, one Saturday night. Monday before last, an 18-year-old who was out of prison for 2 weeks was shot. Their Albany High and Troy High were closed down this Monday because of threats of violence. And one of the things that we want to deal with is solutions to this really pandemic of violence that we're having in the city. And so with that, I would ask you to possibly address some of the questions that we shared with you this evening.
Yes, so I did have a chance to review, if you're referring to.
Yes.
Yes. So I've had a chance to review that, and in order to do it justice, I would ask for the opportunity to really be able to go
Yes,
back.
and that's our intention.
Mhm.
Yeah, I mean, the county executive called me in August and said, Mert, what are we going to do about these shootings? And I've been chasing them down to get a meeting, but we're going to do something relatively soon, whether we have to take the bull by the horns. And obviously, because of the number of programs that you have that immediately address that, you know, you're going to have obviously a key lead role in dealing with this, but it's really a serious problem. You know, I have some proposals, and we're going to sit down and look at it, but what I would like to see is some kind of a team approach with county representatives, city representatives, community people, targeting an election district and funneling people into our programs as well as into jobs. Because, I mean, it's a triage situation, but there are a lot of children who, if they were safe and had viable outlets, could be helped.
And I would like to also respond to that too. When we're looking at the number of programs that we have from various agencies that are providing services, I mean, one of the resources that we get when I was looking at RFPs, it talked about a number around 3,000, it was like 900 families or 800 families and 3,000 children, okay? I'd like to know where those who those 3,000 children are. I don't mean their names, but I would like to know what zip codes they're coming from, and where those families are coming from. Last month, or just this past month, we allotted or appropriated almost at least almost $2 million to several different agencies. I would like to know how effective those programs are. We start out by giving these agencies, they bid on something, and we award them the bid. And then we grant them these 2 one-year options. So I'm concerned with how effective they are and whether or not they actually deserve those 2 one-year options that they get, that we're just adding on. And I think we have to stop just automatically awarding or reauthorizing these programs to these agencies without knowing whether or not how effective they are. Performance measures and also the actual number of people that they are providing services to. I would like to know too, if this $2 million we're giving out, if it's actually paying for the services that are provided, or if it's going to pay for rent or wherever they are that they're giving the services. But we need just a little bit more information right about now. To also measure whether or not if we need more money, or if we need to change the agencies that we're giving this money to. And so we're not carte blanche saying that they're not doing a good job, but we don't know. All we know is how our communities are being so adversely impacted by, services that are supposed to be provided for crime prevention, family services to keep children out of foster care, for drop-in centers and so forth and so on. And so we can no longer feel that we can represent properly without really understanding who the money is going to and how we're measuring whether those programs are effective. So this is no stain on you.
No, and I don't take it as such. I mean, certainly when we are issuing RFPs and we are awarding contracts, that is something that is also important to us to know that the services that we're contracting for are being delivered and meeting the outcomes and goals as outlined in our contract. While I cannot give you specific numbers at this moment, but can certainly provide that going forward, I will say that we have built in and continue to look at our own QA standards internally. In terms of what you're referencing in terms of our prevention contracts, we have monthly meetings with those contract providers to review what is happening with those cases, to review where things are working well, to talk about where there are challenges occurring. For other agencies, such as under the juvenile justice, we're meeting on a quarterly basis. Again, we're looking at performance outcomes, what is working, what is not. So we're certainly cognizant that it's important, especially when we're looking at how this impacts our youth and families, that we need to ensure that the programs and services that we are delivering really are addressing those needs. And so, in regards to, speaking of the prevention RFP, you know, the next year for sending out that RFP will be in 2020 for 2021 contracts. And so we're taking into consideration what is the current landscape, especially when we look at Raise the Age, when we look at PINS, when we look at mental health, when we look at opioid. You know, we're looking at the current services that we have, and do they really meet those needs as we go forward? Or do we need to also look at how we're asking for programs and services and make sure that we're asking for what we're seeing and is critically assessing and having those two align, so.
Okay, I'm sure you can appreciate, as you know, as you have stated, the concerns that we do have with this, and we would like to meet with you and get some kind of report that indicates what the agencies are that we are already awarding the money to, you know, how well they are providing those services. Do we have any other questions from any members?
Just briefly, a process question in terms of the kinds of issues that, you know, Chair Willingham was raising and the questions that we gave to you. Process-wise, is this a situation where you have the data and you can just aggregate it for us with a brief, you know, narrative, or is it something that's going to be kind of a heavy lift to put together?
There's going to be some lift involved because especially with our prevention services, they are county-wide. So to be able, especially if you're looking for a zip code level, granular type of data, some of that will be manual, going through and reviewing the families that have been provided that services and getting that information. So there may be some where we might be able to access a report, but the majority of it is going to be a manual process.
So does that mean that next week would not be reasonable?
Not if you'd like my family to see me.
Okay, all right, okay. Enough said.
Mr. Grimm.
Madam Chair, I appreciate very much what you just said. I would like to see every agency provide a certain amount of clarity, because they do have goals and challenges and accomplishments, but I wish every agency had a chart about these are our 3 critical missions. This is what we tried to do, and this is what we accomplished. And if we could just see that every year in a clear, compelling way, that would enable us to, one, they would focus more on the real true outcome, and we would be able to make more sensible judgments about what might need more money or what might need less money. So I really appreciate what you had to say. If there's one big improvement to the budget process I'd like to see, it's just one clear chart from every agency about the big ticket items that they've gone working on, and how we can judge it from year to year. Thank you.
Thank you, Mr. Green. Are there any other questions?
I had one out there, but I could leave it until you put together that white paper that Mr. Simpson talked about, if you'd like. That was the one I asked Dr. Giordano, between the 16s and the 29-year-olds who might suffer from mental health issues after shootings or whatever. And I think the other question was, I forgot what the other one was. But anyway, you probably wrote something down. You might could address it if you want to.
So in regards to any youth that might be placed at CDYCI, there is a social worker that is on staff, as well as there is a psychiatrist that goes on once a week. And so there is a recognition that, you know, oftentimes youth that are involved in the juvenile justice systems are what we call cross-systems youth, so they're also interfacing with the mental health system. So there's a recognition of needing to be able to have accessibility to that service at CDYCI. So there are those resources to be able to address them while they're insecure. And then part of having the social worker there is being able to facilitate linkages for when they are discharged from CDYCI. Additionally, just in terms of from a comprehensive perspective as it pertains to mental health, you know, as a department, we are involved in several different arenas in terms of addressing mental health. So internally, from within our Children's Mental Health Clinic, we are co-located in 2 areas in the community. We're co-located with the Burn-Knox Westerlo School District, so again, we're able to provide on-site clinical access to services once a week. as well as we're co-located in Cohoes in Dr. DeTerzzi's office. Again, the idea of with DSRIP and Medicaid redesigned, really bringing together behavioral health and physical health. And so as part of that, we are co-located in Dr. DeTerzzi's office once a week as well. In addition, we participate in stakeholder meetings. Maura attends, bringing together CDPC, Albany Med ER, Northern Rivers, LaSalle, and really looking at the landscape of accessibility to mental health services, especially during periods when there is a crisis. What does that look like in terms of accessibility to a bed? What does that look like in terms of accessibility to be able to get an appointment? And how collectively as a system can we look at where the gaps are and look to see how we can improve that. So that's just some of what is happening currently as it pertains to those areas.
Well, let me just.
Oh, and of course, our school, sorry, Madam Chair, I didn't mean to cut you off, but I just also thought about, when we talk about the prevalence of suicide in today's world. And so we do have our SPEC program, which is a direct linkages to school districts, again, to be able to be proactive in terms of being able to reach out and form those partnerships with the school, to be able to talk about suicide. We'll certainly go out, we'll do presentations as requested, and also if we are aware of any incidents, whether it's a suicide or just some traumatic event that's impacting one of the school districts within Albany County, we are reaching out to ask, can one of our clinicians come out and be of service? So we certainly recognize that there is a, need to be responsive to this.
Let me say this. When I looked at the number, and it was 2,900 or something like that, a certain number of families, there are almost 3,000 young people in Albany High. And so when I think about what they went through this week, and I heard you mention Cohoes, okay? And so I'm just concerned, very much concerned with the fact that maybe services, there can be a partnership right there, so that there's access to those types of resources that we know our children need in certain communities. That's a large number of young people in one place.
Yes, and so
I'm representing many zip codes, but I would gather 12206, 12202, 12210, okay, and 12204.
Yes.
And I can name the rest of them from the city of Albany, but I know that those are the zip codes that represent some of our most adversely impacted.
Right, and so while our children's mental health clinic is not directly in any of those Albany City schools, I will say that Northern Rivers is embedded in 3 of the elementary schools within the Albany City School District, and they do provide services to the middle school, and which is also accessible to the high school as well. So while it may not be directly us providing that, there is provision of services for addressing mental health that is being provided within the Albany City School District. That is not to diminish our capacity to be a resource. I just wanted to be to say that there is services that is available within the school district that is being provided currently.
Thank you. I want you to know we really appreciate the service that you provide. We do realize that you have a very tough job, and you do very well at it. But right now, being under the gun, we really have to. I didn't mean to say that.
Solutions.
Behind the 8 ball. That's getting hit also.
I'm trying to actually figure out ways to solve this problem right now. We know that there are a myriad of issues that go into trying to do something like this. But I just want you to know we do appreciate the work that you do and the people that work for you. I want you to know we appreciate that very much.
And it definitely is a team effort. So Maura Manning, Deputy Commissioner, Beth O'Neill, Director of Accounts. I mean, it really is a team effort. There's no way with what this all entails that any one person could facilitate this. So I certainly appreciate the team that I have.
Are there any other questions from any members? If not, thank you very much.
Thank you.